Assessing joint range of motion, both quality and quantity, is a key factor of an orthopedic evaluation. When it comes to extremity joints, I am almost always applying overpressure at the evaluation to really understand the behavior of the joint in its entirety. Take the wrist, for example. If I ask the patient to do some wrist flexion because the patient has a wrist complaint or a hand complaint and I want to assess all planes of motion of the wrist, if they go into flexion and say it's fine, okay, that's what's going on in terms of their active ability. But if I apply some overpressure, you can see we get so many more degrees, and especially if it hurts there, I would have missed that wrist flexion was painful at end range if I didn't apply the overpressure. The same thing goes for shoulder mobility, elbow mobility, and all of the extremities. You need to apply the overpressure. I typically do it with my hands. There's kind of two ways to do it. You can have the patient do it actively and then relax, and then you do it passively. For time, I'm typically saying to the patient, go ahead and flex your wrist all the way down. They'll do it once they get there. I note what's happening, and then I'll take them to end range with my hand. Of course, outside of an examinations, you can have the patient use the table or the floor or the wall or their other hand. But for the evaluation, I want to be efficient. So I'll typically do it that way. When it comes to the spine, I'm less inclined to apply overpressure out of the gate due to the fact that it's the spine. Nonetheless, for some patients, we'll add some overpressure into cervical rotation, for example, lumbar side glide or thoracic rotation or flexion or extension. It really just depends. It's something I may get to a little bit later in the process. Regardless, we're going to need to get to end range at some point to really understand the behavior of the joint, because if you don't get to end range, you're going to miss it. You're going to miss some things, because I know that when I apply overpressure to the wrist in flexion, for example, I should gain some more degrees. And if I don't, that's a problem, and we note it on the evaluation sheet and move on. Also, if there's pain at end range. And because you have two extremities, it's really helpful to compare and contrast. Shoulder flexion here, if the person says it's fine, but when you push it, it goes another 10 degrees. But on the other side, when you push it, it doesn't budge. That's really important. So assess range of motion either independently by yourself, by adding some overpressure, but when you're in a clinical setting, you want a clinician who is really judging the quality and quantity of movement at the joint level in all planes by adding that overpressure.